You might have hip or SI joint or low back pain that you just can't get rid of. And you may have seen a doctor, done rounds of physical therapy, or seen a chiropractor, and maybe you've had some temporary relief. Or maybe you've just been told that you're getting old and these pains are to be expected. Well, that's no good, and I'm never satisfied with those answers. In this video, I'm going to show you how to do the 3 easiest exercises that I know to strengthen one of the most important and often overlooked muscles in your body, your gluteus medius. When your gluteus medius muscle is weak, it wreaks havoc on your biomechanics and sets up your SI joints, your pelvis, your low back, and your hips for imbalances that can lead to pain and dysfunction. I'm Dr. Brant Pedersen, and in my Northern California practice, I help people who feel overlooked and frustrated by the medical system find solutions to get out of pain and get back to doing what they love. Of all the muscles I test on my patients, there is none that I find as frequently weak as the gluteus medius. I think it is a result of our modern sedentary lifestyle, although I even see it weak in many of the athletes that I treat. But when my patients learn that their gluteus medius is weak and we put in some work to get it strengthened, the results are awesome to see. This video was created as a resource for people who needed to start with more basic, easier exercises to help strengthen severely weak gluteus medius muscles. If you have not seen this video up here, which deep dives into how the gluteus medius works, why it's such an important muscle, and teaches a simple test you can do at home to assess if your gluteus medius are weak, then make sure to check it out. Your gluteus medius muscle lives right here. It's comes off your iliac crest right below it and comes out to your greater trochanter. And it has 2 motions that it does. One is that it moves your hip out to the side, but the other action that it has is actually stabilizing your pelvis, keeping your pelvis level. When it isn't doing that properly, what people will notice is that one hip will jut out to the side. Actually, it's like a model walk where their hips will be popping out to the side when they're walking if they have a weak glute medius. Also, when they're standing, they might notice that they just rest on their tissues on one side and then rest on their tissues on the other. If you want to stand up for a moment, you can actually feel your glute medius. You'd put your hands on top of your hips. This actually isn't your hips are here. That's the hip joint. But if you put your hands where most people think of putting their hips, that you're putting your hands on your iliac crest, then you're going to come down just a little bit from there, and you'll feel coming off the bone into a soft area. Now, with your fingers there, what I want you to do is put your weight over onto that leg, and you'll feel that muscle contract. If you shift your weight over to the other side, you're going to feel that muscle get soft. That's that glute medius contracting underneath your fingers as you shift back and forth. You might find some trigger points that are in that muscle that are tender. This book here by Travell and Simmons, Myofascial Pain and Dysfunction, the Trigger Point Manual, the leading authority on trigger points and where referred pain patterns go. And this shows the pain patterns for the gluteus medius muscle, showing them here around the gluteal region, up into the SI joint, right over the SI joint, and over the sacrum there as well. Some of it coming down a little bit into the back of the thigh. So those are all areas where we will see people that have gluteus medius trigger points or problems in their gluteus medius complaining of pain. So here are the 3 most basic exercises that I know to strengthen the gluteus medius muscles. At the end of this video, I'll summarize the sets, reps, and daily program I like, so make sure to stick around. And I know that for some people, myself included, I like to have a PDF handout that lists the exercises and key points to follow. So I've included a link to just that in the video description below. Now let's get started. Before this first exercise, I want to remind you that it is important to work with your doctor if you have pain. I know in my life that I have a hard time asking for help. It's something I'm working on. But with our health, it is vital to make sure that you are working with someone who can help you rule out red flags and hopefully get you some answers to help you feel better. None of the exercises in this video should be painful. If they are, don't do them. This first exercise is called the Seated Clam, and it's designed to gently strengthen your glute medius and maximus. And it also helps stabilize your hip complex. And you do all that while you're seated. Pretty cool. To get started, you want to sit on something that's a bit elevated, like the edge of your bed, maybe a couch, or maybe the arm of the couch. but you want to have it so that your thighs are sloping downwards a little bit. You also want to have your heels together, and then you're going to use your hands to help support you while you tuck your tail underneath you a little bit and lean back just a bit. Then you're going to push your heels together and squeeze your buttocks muscles. You really want to focus on pushing your heels together, and you're going to hold this position for about 30 seconds. You should feel the contraction and activation in your glute region, and then when you're done with the 30 seconds, you should feel your body drop back down to the chair a bit as your muscles relax. I like to do 5 sets of these 30-second holds. Do another one now. Really feeling it out in this region, but also back behind. Once this exercise feels like you've got it and you would like a little extra challenge, there's 2 variations you can do. One is if you have an SI belt or a trochanteric belt, because maybe you have some SI joint pain, you can take that belt, or any belt for that matter, and put it around just above your knees. And again, we're going to lean back, tuck our tail underneath us. We're going to push our knees outwards, our legs outwards, as we push our heels together. And again, holding that for 30 seconds. But because we have the added resistance here, don't forget to push your heels together as you do this. Again, we want to feel it in our gluteal region. And another variation that you can do is using an elastic band. So we can put the elastic band above our knees, again leaning back, tucking our tail underneath us, pushing our heels together as we pull our legs apart. You can do this as a slow movement of bringing your legs together and out apart, or you can just maintain pushing your heels together as you push out against this. This next exercise is another version of the clamshell exercise called the advanced clam that works your gluteus medius muscles, but also your external hip rotators. Another thing I like about this exercise is that it helps pattern in good motor control of these muscles. For this exercise, you'll start by lying on your side. Once you're lying on your side, you're ready to begin this exercise. You'll bring your thighs up to about 45 degrees, and then you're going to take your femur, your thigh bone, and make it about 6 inches between your knees here. And then the exercise is simply to take, while you keep your thigh bone here, to touch your feet together, and then to bring your foot up and out. So bringing your feet together, bring your foot up and out. What you're doing is rotating around your thigh bone. So ideally, your thigh bone doesn't come together or apart like it did in the original clamshell exercise, but that your thigh bone stays perfectly parallel to your other thigh bone, and you're just moving your calf in and out. I like to do 10 of these on each side, and then I will take a little break. The muscles that we're working and where you should feel it is up here in your hip, a little bit into your buttocks, but more on your lateral hip. And just try and get as much range of motion as is comfortable when you are rotating outwards and then inwards, touching together. Again, this is called the advanced clam. I'll do about 10 reps, take a little break. You can switch to the other side if you want to at that time, or just stay on the one side and then switch and do 3 sets of 10 reps on the other side. This last exercise is called the fire hydrant exercise, and it's a body weight exercise that involves some hip range of motion, but it's also training in some core stability. Those two really go together. You're going to do this exercise on the floor, so doing it on something soft like carpet or another soft surface like an exercise mat or a yoga mat can make it more comfortable. And you're going to start in a quadruped position. So we're going to have our hands underneath our shoulders, our knees underneath our hips, and we're going to have our spine in neutral. We don't want to be rounded in our back, and we don't want to be arched. We want to maintain this neutral spine throughout the whole exercise. Also, we want to stay braced in our core like we're punching ourselves and it wouldn't hurt. So from here, what we're going to do is slowly bring our leg out to the side, keeping our knee bent. And as we do this, we're going to hold this here for 5 seconds. And we're going to maintain our core. We're not going to let the motion have come from here like this. We're going to maintain our neutral spine and then slowly bring the leg back in.
Then I'm going to come out to the side here. Again, maintaining my core, not rotating from my spine or my pelvis. Just trying to come from my hip for 5 seconds. If you cannot get your hip up very far, you can only go here. That's okay. The most important thing is that you feel the contraction in your glute here, in your glute medius, but also your glute max and your external hip rotators. We're going to hold like that. We don't want to let our leg go straight, and again, we don't want to let our pelvis go up. I like to hold those for 5 seconds, go back and forth from side to side, and do 10 reps on each side, and take a little break, and do 3 sets like that. If you want to make it a little bit more difficult, you can take and put a piece of elastic band above your knees, and then you're holding that resistance against the band. And then sometimes people, to make it even more difficult, will take an ankle weight, either put it at their ankle or right at the top of their calf. And so they're lifting up against that weight. It's pretty cool with weights like this. You can take and make them as heavy or as light as you want so they're adjustable. Remember, as you do these exercises, that this muscle didn't get weak over the last few weeks or months. It has slowly been getting weaker and weaker over years. The good news is that I don't find that it takes years to get it back to its full strength, but it does take a commitment to being consistent. If you'll show up and do these exercises every other day for a few weeks, I think you'll be amazed at just how much progress you'll see. That is what I'm used to seeing. Another thing that I see when people have chronically weak glute medius muscles is that they also many times end up having SI joint pain and instability. So watch this video here next, where I help you identify if your SI joint is a problem and then give you some simple things you can do at home to help it work better. Until next time, take care.